Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you this preview of the MGMA conference called the Medical Practice Excellence Conference. And we're excited to be here with a special guest, Dr. Halee Fischer-Wright. She's president and CEO of MGMA, which is the Medical Group Management Association. Welcome, Halee.
Well, thank you, John, and I really appreciate the invite.
Yeah, so I'm excited to hear. Man, what a year we've had. So I'm really interested to hear how you and your members of MGMA are doing amidst all the craziness, we'll just call it, of COVID and everything. But before we get to that, can you tell us a little bit about yourself? And I think a lot of people know MGMA, but maybe where is MGMA today?
Well, so a little bit about myself. MGMA is actually located in Denver, Colorado, and that's actually where I'm from. I was born and raised here, went to the University of Colorado for college and for med school. And then from there, I pretty much had an asynchronous career. So if you want your kids to listen to this on here's what you need to do to become a doctor, don't listen to my career path. I started a practice from scratch with a partner, ran the practice, sold the practice, bought other practices. That led me on a pathway of becoming a practice consultant. And from there, I ran large group practices, was a business consultant that happened to be a co-author of a New York Times bestselling book, and
Wow.
then started my own business. So, and then at the time that my husband was diagnosed with kidney cancer, he's doing fine now, I sold those businesses and became a chief medical officer. So a very asynchronous career, but it's allowed me to see healthcare delivery on multiple different fronts and frankly around the world as well.
Yeah. Well, I think that, that's I think my kids, I'd be proud if they had that career path. So you should be proud of it as well. So, everyone's gone through all sorts of interesting trials amid COVID-19. How's MGMA doing amidst everything that's happening with it? And also maybe tell us a little bit about your new virtual MPEC conference, which is the Medical Practice Excellent Conference.
Absolutely. So, we're a 94-year-old healthcare association. And most of the older healthcare associations like us, the AMA, the American Hospital Association, et cetera, we tend to be institutional. In other words, we tend to be monolithic. We do what we do, not very flexible, and very straightforward. This has been, this COVID situation has been for the organization itself a tremendous opportunity to, number one, provide services for people, for frontline practices of all sizes and makes. But in addition, it's actually been an incredible opportunity for us to reinvent ourselves, which really leads us to the Medical Practice Executive Conference. So we have, like everybody in the United States and around the globe, have been really struggling with how do we deliver products and services at a time where you can't do things face to face. I mean, even in this interview, we were talking about before it started, we'd rather do this face to face, but instead we're doing it by video. So what we did right off the bat is we recognized this is not the time that we want to be super proprietary about our service. We want to be able to help medical practice. Maybe you may not be a member of MGMA, but we're going to partner with all the other major healthcare associations to develop a suite of content that'll help our practices get through, and by our, I mean the United States, get through this situation. So if you remember when all this went down in March, in just a snap of the fingers, volumes of patients, regardless of what specialty you were in, dropped like a rock. And
Yep.
people were completely unprepared. And it didn't matter if you were part of the largest health systems in the country or if you were a two-doctor practice, you were instantaneously so basically hamstrung by this global pandemic. And so we developed a whole constellation of services that how to get resources. Number one thing that people needed was PPE. That was for the first 2 weeks. Then as soon as people figured out, wait, there's no cash that's going to be coming in, then it was how do you get capital? And so through our policy group, our membership group, and our business development group, we were able to develop a whole host of resources and then our community, our membership communities, we had things in regards to how do you access the loans, the small business loans. If you're a larger organization, more than 500 FTE, what do you do then? Here's what you need to know about the Medicare forgiveness program. How do you apply for this? And then on top of all that, there was that just rapid shift to telehealth. And by shift, I'm going to use air quotes as shift, because it basically went from 0 to something. And now we're kind of going to come back to about 20-25% utilization of telehealth. So it was a shift. I don't think that's permanent, but it's kind of like the pendulum. We swing back this way, and then we're not going to come back all the way, but we're going to settle out. But helping practices do that. So after 10 years of talking about the rise of telehealth, we were on the vanguard of here's how you do it, how to get it up, how to get it going, and how to bill for it, and how to collect as quickly as possible. And so those are just some of the things that we did in that first 4 to 6 weeks. And I would say since about the second week in March is when really everything got very challenging.
Right.
Now, what we've noticed across the country is that how COVID has affected different geographic areas is at different areas, different times, different situations. And because we have such robust membership communities, every region has a unique spin on how they're navigating COVID. And so we're able to quantize and share that information with our members.
No, that's great. And just to clarify your comment about telehealth adoption, because you're right. I didn't think we went 0 to 60. We went 0 to 100%. Right? Like, I mean,
Yeah.
that's really how fast we went. But and when you said that you don't think that telehealth's going to stay forever, I assume you mean it's going to not, the 100% is not going to stay, but the 20-25% you think is going to stay, or do you think it's going to keep falling from there?
No. So the thing that your listener may not know is telehealth is not reimbursed at the same rate as an in-person office visit. And the customer satisfaction isn't statistically as high as an in-person visit. If you're a millennial, you love telehealth. But if you're a Gen Xer, baby boomer, etc., this is not how and I'm talking broad generalizations, generationally, how you prefer to have your healthcare delivered. So telehealth is typically paid. Well, during this time period of COVID, there was legislation passed so that we got enhanced reimbursement, about 66% of an in-office visit. But here's the challenge with that. You still have to keep your staff, you still have to pay your rent. And by the way, it takes the same amount of time as a physician seeing a patient in the office. So you have all the expenses and everything going on, but you're just basically delivering healthcare, but getting reimbursed at a smaller rate. That kind of enhanced compensation that allowed us to get 66% has actually diminished now. And so depending on the health insurer and things like that, it's in the 30 to 50% range. So it's a combination of compensation and patient satisfaction. Most patients do want to come in, and it's intuitively, that not every medical problem suits itself to telehealth. So, your mind can wander on what exams should not be done via telehealth, but suffices to say, as a former practicing pediatrician, it's really impossible to do baby exams in regards to a video conference. But if your baby's having problems, we can certainly talk about it, and I can get a good visualization or rashes or things like that. So, it's probably good for about 50%. Let's go back to the older population with chronic diseases. Those people managing chronic disease, I think, is very effective on telehealth.
Yeah, well, and I think to your point, many of the people I know that are seniors with chronic conditions, their visits to the doctor are almost their social network. Like,
yes.
I think we don't understand that fully. That's their emotional, social support in many cases, which Yeah, anyway, we could talk about this forever, but
Yes.
I actually think your biggest point is the lack of reimbursement. And I think that's one
Yeah.
of the things I saw MGMA do. And I know you have a lot of good policy people that are working on this, and you pushed really hard
Mhm.
to get telehealth reimbursed for a phone call, since that was
Yes.
often all that was possible during the COVID-19 crisis. So, kudos to you for working on that. And I mean, as you said, there's a lot more to play out, I think, in the reimbursement front. And anyway, we could talk about telehealth forever, but
Yes.
but let's talk about some of the impact you've seen on,
Sure.
from COVID-19 on the medical practices. We talked about the shift to telehealth, which obviously is a
Yeah.
major one. What were some of the other impacts? You talked about revenue, which I mean, to me is
Yeah.
somewhat the untold story of the impact.
Well, I think absolutely. So 97% of practices experienced a drop in volume of 40% or more that
Wow.
first part of March.
Uh-huh.
And so think about this. Medical practices actually are one of the businesses that, because of their corporate structure, are typically set up as pass-through entities. So you're not sitting on large reserves of cash. So unlike the University of Pittsburgh or Mayo that are sitting on reserves of billions of dollars, your average medical practice of 6 physicians typically doesn't have cash reserves. So then all of a sudden you don't have cash coming in at all, but you have staff, you have physicians, you have all the things that I mentioned before. Those expenses have not gone down necessarily. Even if you do furlough employees, you still have expenses, but your cash wasn't coming in. And one of the things that we saw is that no one anticipated this, so no one had planned ahead. And number two was that the infrastructure in regards to how do you navigate negotiating with your landlord, how do you navigate with your medical supply company, how do you, as a physician, we're the organization, are kind of the definition of MGMA and how most of the people know us is that we're the organization that provides the gold standard for physician compensation survey to the entire industry of healthcare.
Yep.
Well, what does it mean when 97% of the practices have a drop in volume of at least 40% to that physician compensation? And how do you make everything else work in that regard? So those were the challenges that most medical practices were navigating. What we're seeing now, so this is being recorded the second week in October, what we're seeing now is most medical practices are still not back to full uh, productivity. Now, if you're a fee-for-service practice, which is 75% of the United States, that means that 3/4 of the practices in the United States are not up to their full revenue potential and probably won't be for another calendar year. If
Wow.
you are a practice in that 25% that you are managing costs or risk-based or things like that, it's actually a great time for you. It's a great time if you're an insurance company because no one's going to the doctor's office, so you're not paying out. The downside is, as a society, we are delaying preventive care, and that's going to play out for these medical practices in the sense that we're going to have to pay the piper next year, the year after, and we don't have the resources to take care of the backup because we're now capital starved. And so we're going to see several of our independent practices probably disappear. They just can't financially make it. And yet the need is going to be higher. So it's going to be this very counterintuitive challenge that happens, I think, over the next 12 to 18 months.
And that was my next question, really, is how did this impact the small practices versus the large practices? And I mean, there's so many nuances to what you described. And I think of one of my friends who's an orthopedic surgeon, and he was having the conversation with one of his employees who was really angry they weren't getting the raise they thought they were going to get. And he had to step back and be like, do you understand where we are? Just be
Yeah.
grateful, one, you have a job and you haven't gotten furloughed or other things. But how has that impacted the small practices versus large? And my fear is small practices are in trouble. But what's your take?
Um, I think you have a very realistic understanding of the layout. I think small practices are in, to use your term, in trouble in the sense that I'm not sure, depending on how long this pandemic goes on, I'm not sure how long they can sustain this product drop in productivity and kind of the new world order under COVID. And we used to laugh when I was not laugh, ha ha, but as a
Yeah.
pediatrician, you hated flu season, but you loved flu season because it allowed you to play Christmas bonuses, right? Well,
Sure.
the news is that we're getting people to stay home. We're doing more in telehealth. So those patients aren't going into the office. For your friend, the orthopedic surgeon, if you were going to get a knee or hip or shoulder replacement, you're going to put that off because those are elective procedures. And would you rather do it at a time that you don't have to risk getting COVID? If you wait 9 months, you've already had this issue for 3 years. Are you willing to wait another 9 months so you don't have to risk that? So those are all the things that are being balanced. The smaller practices just don't have the fat, if you will, to navigate that. And you bring up a very valid point, which is, your orthopedic colleague who's basically the staff is saying, but wait a minute, I want to raise, and my life has gone on. I have kids. I have all these things that I need to navigate. And so there's this kind of like, hey, there's for people in leadership, it's not, hey, you should be grateful, but we're working so hard to try to keep things on a steady path. And yet but expectations haven't been leveled out too. And that's one of the things that in the smaller practices we're going to see, and we are seeing, a talent migration. So your
Mm.
orthopedic surgeon, if they were in a practice of 2 doctors and they were struggling, and maybe those physicians had to finance their staff with their own salary, larger health systems will probably gobble up the high-end talent that may have been independent, because it gives them a sense of security that they didn't have during this time period as well.
No, for sure. And I mean, it's such a challenging situation for all of these practices, and not just what we talked about. They're getting hit by the telehealth
Yes.
vendors. So, I mean, if
Yeah.
I'm choosing telehealth, maybe I choose the more convenient direct-to-consumer one rather than my normal doctor's office. So, there's a lot of challenges. Walmart's coming into the space, Amazon's hitting the space.
Yeah.
So it's not just COVID, it's everything else as well. So, I mean, I don't want to be doom and gloom, right? Like,
Yeah.
there's still lots of great things happening, and lots of people that are so passionate about what they're doing and care so much for the patients have done amazing things. So, what are some of the things MGMA has been doing to help these medical groups? What can they look to MGMA to help them out with?
Well, I think that's a great opportunity for us to talk about the Medical Practice Excellence Conference. So we had to cancel our annual conference. Our annual conference had gone on really since the 1930s historically. And it was our big event. It was our annual event. Anywhere from 4,000 to 6,000 people attended. We had name brand speakers, Malcolm Gladwell, Atul Gawande, Mel Robbins, had Simon Sinek, just to throw a few names. We also had Jim Gaffigan as well.
I was gonna say,
At
I
one
think I saw
point,
Joy Behar one time. Yeah,
yeah.
some great ones.
So with some great speakers, depending on kind of what you wanted to hear, your appetite at the time.
Yeah.
This year we took a very different approach, and that was we had to cancel our conference. We were in San Antonio, and at the time that we had to make that decision, San Antonio was a hotspot for the nation. In Bexar County. So what we've done is we've created a partnership with multiple vendors and with a lot of our members to create the state-of-the-art virtual experience. And very much what you've talked about, John, that we have practices that are the tiny practices, and then you have practices that are some of the biggest healthcare systems in the United States and arguably in the world. There's something for everyone there. And so we just went through this morning with our team, how in the same way that we're doing these interviews, and I've done a lot of interviews by these kind of video chats. What we're doing is saying, if you had to sit in front of your 13-inch computer screen, what is engaging? What's exciting? A 2-hour lecture is not going to do it if you're sitting at a desk all day long. So how can we shorten things? How do we make the content palatable? How do we reach more people? How do we make it exciting and engaging, and so that you want to learn this? And then, of course, we're going to be focusing on how you navigate COVID, how you navigate COVID today, how you plan for the future, and how are the changes of COVID going to shape healthcare in the future. Now, one of the things that is interesting is we're having this conference, 3 weeks before the election. That'll have certainly an impact. So we're talking about the potential effect of the election on medical practice in the future as well. And there are distinctive changes, or I should say influences, that any of the candidates or either candidate wins. There's pathways they're going to do that are very different. So that's a very different pathway, red or blue, depending on what flavor wins.
Yeah. And I think on top of the conference, my favorite piece of MGMA as well is all the data. I mean, you have so much data. I mean, you talked about the physician salary piece, but I think there's so much data to understand what practices are dealing with, how are practices doing compared to other practices. Understanding that, I think, is going to become more and more important just if these organizations want to survive.
Absolutely. And it's why what we're doing in our conference is convening the leaders across the country to share tools, resources, and solutions. Our theme is Rise Above. And it really is, I think medical practice has really been the unsung heroes of the COVID crisis. And we're talking about how can you rise above and navigate through these turbulent waters. We're going to be discussing things like financial management, surviving, technology trends, but most importantly, on our keynote speakers, 36 concurrent sessions and 70 sessions through the days, we're going to be talking about very much exactly what you're saying, which is, how do we survive? I mean, it really does boil down to sustainability. And for us on the Rise Above, it's more than just sustainability. I think because we're frontline, it's so in front of us. How do we survive? But what we want to do is to rise above and to thrive. I mean, I don't want to steal Kaiser's tagline, all due respect, great, brilliant marketing, but how do we create the situation that allows practices to take what they need so that they can plan and really take advantage of this situation to build our healthcare system for the future?
So if you were running a practice today, what are the things you would do that a medical group needs to do, as you said, to thrive in this challenging environment?
Yeah, there's a couple things. And my husband is a owner of a medical practice, so this isn't a theoretical question to me. This is very real. Let me put it this way. My house is tied to his practice, so I'm highly invested that he makes it through this time.
I bet your dinner tables are a lot of fun. My wife doesn't want any talk of healthcare. For you, it's just work or home. That might be a challenge.
I would say it's different because I'm in administration and he is practicing physician. Many of the people listening to this will understand that there's a little bit of this that goes on. And it's very much, to answer your question, that is actually the dynamic that I'm going to be pointing out. And that is, for a lot of the physician owners of our independent practices, they became owners because they loved practicing medicine. I want to serve patients. I want to be with patients. And for many years, the whole message I've been getting is that you have to marry business and the practice of medicine, the art of medicine, together to be able to be successful. This is actually the proof of the assertion that I've been making for 5 years, which is, to be able to succeed through this time period, you really do have to embrace the fact that you have to be a very savvy business person. And all those kind of detailing things that intuitively for a lot of physicians are later, need to be done now. So you need to take a look at it's kind of business 101. What is the money coming in? What is the money going out? How do you decrease the money going out? How do you increase the money going in? Sounds incredibly simplistic when I put it out that way. But once you start to just ask yourself those simple questions and start to go through that line, it doesn't matter if you're a 2-doctor practice or a 1,000-doctor practice. Those are the things that you have to take into consideration moving forward. A lot of practices are reviewing their staffing. They furloughed the staff, things like that. From an MGMA, our statistics show that you need 4.3 staffing members for a maximum productivity doctor has 4.3 staff members. But one of the things that we don't specify in that statistic is how are you deploying those 4.3 staff members? This is the time, as you're not seeing 100% of your patient volume, this is a good time to think about how am I deploying those 4.3 staff members to hit maximum reimbursement, decrease expense. And those are the questions that we're asking our members and frankly, the people that are our audience to think about in the long run. How do you become more efficient? Statistic from the Institute of Medicine is that 30 to 50% of the dollar that we spend in healthcare is wasted. How do you in the medical practice strip out that waste?
I love that. I think taking that business mindset, I've kind of become known for follow the money, like that explains a lot of healthcare. But I think there's another layer to that business mindset that, on top of what you said, which is the patient experience. Which, so many doctors took that for granted because they had the captive audience, they had the captive patient panel, and now that experience, am I at risk for COVID? How are you going to virtually check me in? Are you going to do telemedicine or not? And what's the experience there? I mean, those are questions that they quite frankly didn't have to answer 8 months ago. Is that where we're at? But I think they need to now.
Well, and one of the things that I talk about with our governmental affairs office, with translation, our regulatory group, is all the trends we're seeing in COVID were already in place. It's just that what COVID did was squish them. So instead of a 5-year horizon, 3-year horizon, you've got 2 months, 3 months, 4 months. So very much what you're talking about is how do you figure these things out with the patient experience with COVID? What I would argue is the rise of consumerism has fundamentally challenged our healthcare system because it really was set up for the doctor. Here's the schedule. The doctor has 3:45 available on Wednesday. Will that work for you? No, I've got a job, right? And I've got kids. What am I going to do? I'm homeschooling now. I can't take that time away. And so not only are practices having to navigate the COVID challenges, but because there have been the rise of so many technological solutions during this short period of time, really, in healthcare, they're starting to have to navigate some of the consumerism that they probably wouldn't have had to, all things being equal, navigate for 3 to 5 years.
No, that's a great point. And I think that's one of the long-lasting impacts of COVID is going to be that rise of consumerism. What do you see as some of the other long-lasting things that are going to happen? Maybe good or bad, right? Yeah. I mean, small practice is suffering. I think maybe one of those bad things. What's your take on it?
So I don't look at things in good or bad because I think there's pros and cons and everything. So you point out small practices. I think there'll be consolidation of small practices, but I think we're already seeing, and you mentioned it, other players getting into healthcare. So it used to be independent practices, meaning physician-owned, and large healthcare systems. Now we see other players in. You mentioned Walmart, Amazon. I'm going to mention DaVita has been in creating clinics as well, but we're going to see we see private equity coming in like gangbusters.
That's interesting.
Coaching. So we have that dynamic coming in. The thing that I'm really seeing is now that we have Walmart firmly entrenched, now that we have Amazon kind of flirting with how do we do this better, Apple too, I think we're going to see those big players start to take a run at insurance companies. And so try to cut out third-party administrators and insurance companies. So what I see is that's going to race to decrease healthcare costs. Now, that's one trend that I see going on. Another trend that I see are physicians merging together. Physicians, and I talk about this a lot when I do public speaking, we're not trained to get along with each other because we've been competing against each other since we were small fry, right? Yeah. So, the thing is, if you get into med school, I may not get into med school, so I have to compete against you, get the best residency, get the best job, etc. So now all of a sudden we're seeing the rise of physicians collaborating together, which I never thought would happen during my career. to do care collaboratives. So groups like Aledade that are physician-run ACOs that are just knocking it out of the park. I think we're going to see expansion of those type of models. So, and I think the number one trend that I'd ask people to leave with today is reimbursement for healthcare is going to be cut. We have no choice. We just took on $8 trillion of debt federally to survive. We're going to take on more one way or another. And a right place to cut in the budget is in healthcare. So the Trump administration had already budgeted a $450 billion cut over 4 years. I think we're going to see a cut in that spending, but I think there's ways to actually, and the people who typically pay for that are frontline providers.
Right.
Because usually you say, oh, I don't want to decrease reimbursement to the hospitals and pharmacists. You know, I think we all shake our hand at pharmaceutical costs.
Yes,
so
the pharma lobby.
They're very effective, but I
Yep.
think I think there are definitely ways that if physicians can band together and be very clear about the value that they deliver, that we can actually navigate these changes and cuts in a way that it doesn't really hurt us as frontline providers.
Well, and I think your comment about keeping the business in mind and remembering that it is a business, I think that's going to be key navigating these times. And if you do it, I think there's opportunities. You know, at the beginning of this, one of my friends, entrepreneur friends, said, you know, whenever there's a wave, if you have the right surfboard, you can do all right. So thanks so much for spending the time with us, Halee. I appreciate these insights, and I'm sure everyone can go check out mgma.com to find out all the resources you have. Also check out the MPEC conference there that's going to be virtual. I'm excited to participate and learn as well. And thanks everyone for watching. If you want to find more great health IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Halee.
Thank you, John.